Good afternoon, everyone. My name is Donna Gunkel. I am the Director of Clinical Integration here at United Medical ACO. I will be your host this afternoon as Kamal is off traveling. So today for our United Medical Diabetes Program Wellness webinar, um, I'm just going to do a quick introduction. So we have our wellness program team on the next slide. So Kamal is our chairman, and again, myself, Donna Gunkel. Dr. Hundle is our program director. We have Caroline Weber, who is our dietitian who oversees the diabetes program. And then we have our two social workers, Roxana and Carla, who are also part of the team. So our diabetes wellness webinar program is held once a month. Usually it is the second Friday, but sometimes that changes due to other needs that we need to do as far as presentations. And we do go through, a variety of topics. We have guest speakers with us. Typically, we have a provider and or another specialist from one of the agencies that we deal with, like someone who talks about the continuous glucose monitoring, et cetera. But we typically, in the course of a year, go through many topics related to endocrinology, cardiology, nephrology, podiatry. We do touch on the social work, mental health aspect, physical therapy, and many more. So today with us, our two panelists will be Joseph Auble from our United Medical Clinic, and we do appreciate you being with us on short notice this week, and also Caroline. So today we're going to talk about diabetes and the immune system. So with that, I will turn it over to you, Joseph, to talk us through that.
Fantastic. Thank you so much, Donna. So today we'll be going through the diabetes diagnosis and its effect and impact on the immune system. There are many causes and effects to both of these conditions, and they really play hand in hand together. So very interested and excited to talk about this topic today. So thank you. So first, we'll start off with just explaining what diabetes is. Let's get a general foundation of knowledge for what we're dealing with, right? So there's two main types of diabetes. There's type 1 diabetes and type 2 diabetes. Type 1 diabetes is an autoimmune condition. Autoimmune meaning against the body. So our immune systems are attacking our pancreas, specifically called the beta cells in the pancreas that form our insulin. So what is insulin? Insulin is a hormone released by the pancreas that helps the cells intake sugar. And so what happens is, since there's no insulin in type 1 diabetes, we see it depicted here on the left side, the glucose is free flowing throughout the vasculature and doesn't get absorbed by this tissue unless we give subcutaneous insulin. Now, that's a problem, okay? And we're going to talk about why it's a problem as it's related to the immune system today. The second type of diabetes is type 2 diabetes. This is more weight dependent. This is when the pancreas is producing insulin. However, the body tissues here are kind of resistant to it. So they're not going to respond as well as they should typically. Glucose isn't going to be absorbed as it typically does. And what happens is we're having the same theme here. The sugar is free flowing throughout the vasculature and it's not absorbed by the cells. So our immune system. It is hefty. It is strong. It is multidimensional. It is composed of a vascular system called the lymphatic system that runs throughout your entire body. It's like a highway for the immune cells, and they can go in and out of the arteries and the vessels in the body and suck up pathogens and take them back to the lymph nodes here and the lymphatic system. And they can even take them up in the arterial system as well, but typically they like to run along these highways here. And so I always call the lymph nodes as kind of the basis of the immune system where they all gather together. Now, this is a cool depiction, a YouTube video actually, on a immune cell tracking a bacterium. This is in your body and the red blood cells are to the side here. And so it's tracking it with messengers and proteins. And we'll come to find out that these messengers and proteins are actually impacted by diabetes, and high blood sugar. So let's get back here to this PowerPoint. There we go. Oh, excuse me. YouTube is acting up here. Let me get them off. Perfect. Thank you. Sorry about that. So, how does diabetes affect the immune system? So we're going to talk about three main areas today. First is the dysfunction of immune cells. Second is how insulin can actually help modulate the immune system in diabetes. And so insulin is a big player in how our T cells operate. And our T cells are immune cells that send antibodies out, memory cells that are helping the immune system fight off infection. And the third one is, a lot of blood sugar is going to disrupt these proteins that we just saw. So those bacteria that was running around in the cell that was chasing it, it actually depends on those proteins as well, and high blood sugar can disrupt them. But it also causes inflammation and atherosclerosis, leading to plaque on vessels, vascular disease, potential heart attack or stroke. So the first topic is dysfunction of the immune cells. There's a study done that says diabetes or high blood sugar can cause cytokine inhibition. What is a cytokine? So a cytokine are those chemical messengers that help cells communicate between one another. And so high blood sugar is going to disrupt that communication and then cause the cells not to operate as they typically should. In this case, not to effectively or ideally combat the pathogen that the immune cell typically would. It'll also cause something we call innate immune dysfunction. The innate immune system is the first line of defense. Those are the cells that go right into the battle. It's the frontline defense for the immune system. And so what happens is sometimes high blood sugar and diabetes can affect the way they function as well, or even alter the way they function. And the last one here is the inhibition of antibodies. Antibodies are sent out from those T cells we were talking about and B cells. And what happens is it can stop them from functioning as well or catching on to a pathogen or helping other immune cells even defeat a pathogen. So the second one is, insulin is going to modulate our immune system. And diabetes with the immune system can cause that T cell impairment. So insulin is heavily related to the immune response. Insulin actually can bind to a receptor on those immune cells and stimulate them, make them work harder, make them work faster, direct them where to go, provide energy for the cell and other cascades throughout the cell that help it function better. And so when insulin does bind to these T cells, they're able to send out more signals, activate other parts of the immunity, and that communication line together is much more coherent. So the insulin receptor or signaling molecule is like a second push to the immune system. As Dr. Weiner said in this study here, it can ensure that it can fight off the infection with the best possible weapons it has. Providing insulin to the cell is like giving the cell a whole arsenal of what to and how to deal with specific pathogens like bacteria, viruses, and other invaders in the body. So this is just a picture depicting that. What I want you to take from this is see the insulin binding here at the end of the cell. It sets off a cascade that basically helps proliferate this guy here and effectors. And these are cytokines, those messengers that communicate. So by insulin binding, it allows the T cell here to effectively more readily communicate with other cells, which provides a better response to these pathogens and invaders. And overall, insulin is very important in the modulation of the immune system. And so in type 1 or type 2 diabetes, whether we're dealing with the insulin resistance like we are in type 2 diabetes or the lack of insulin like we are in type 1 diabetes, it's very important that insulin is provided to these cells to help them function better. So, the third topic we're going to talk about today is the, hyperglycemia, as we've been pinpointing, can disrupt the immune system proteins. And not only does that affect how we deal with invaders in our body, but it can also lead to inflammation and atherosclerosis. So you're not off the hook quite yet, because what happens is when we have high blood sugar, it's going to cause dysfunction of the vessel systems. That dysfunction is going to lead to a lot of oxidative stress on the vasculature. It's going to increase the inflammatory markers and the production of vasoactive markers. Vasoactive meaning whether the vessel opens or whether it constricts further. And that's a big factor in how atherosclerosis forms in the first place. So take by this picture here. Inflammation in the blood vessels can lead to atherosclerosis. And so diabetes can confer that worst phenotype. And so we see hyperglycemia present in this cell here. It's got a lot of sugar, which means we're having these immune cells nearby. That promotes a lot of inflammation and also can disrupt the vasculature a little bit. Now all of these players are coming in and we see how the vasculature is kind of split in half here. And so this plaque is more readily formed. This plaque is harder than it normally should be, and it's increasing at a higher rate than a person without diabetes because of that high blood sugar. So again, just hitting the point home here, it can lead to the vasoconstriction or the constriction of those vessels, more inflammation in your vessels, and overall both of them can lead to more fibrosis and remodeling of those vessels together. And so it's important that we understand that the immune system, by being activated by high blood sugar, can almost act in a negative effect on our vasculature and cause increased risk for peripheral arterial disease, heart attack, stroke, and other vascular complications that we typically don't see in patients without diabetes or high blood sugar. So you may be thinking, well, I don't have diabetes, but I have prediabetes. So does that put me at risk? Well, it does, right? Because we're getting to that risk of hyperglycemia. Okay. Hyperglycemia thus can lead to these kind of complications and then even worsened by potential likelihood of diabetes thereafter, if there is one. So just to summarize here, diabetes causes the immune cells just not to work as well. They're not as efficient as they typically would be if we have normal blood sugar and regular insulin and not a lot of resistance to insulin throughout the body. Our T cells are going to work better with insulin. When insulin binds, we saw that cascade effect, and we saw how they were more readily to send out those chemical messengers and recruit help and have a bigger arsenal. Diabetes can also increase the inflammation in the body. It can tell immune cells to do, kind of bad things. Create more inflammation can lead to atherosclerosis, narrowing of those vessels, putting you more at risk for something like cardiovascular disease. So why is this important? Well, it's important because our diabetics are at a disadvantage. When it comes to infection, not only is that inflammatory response going to be heightened, but the healing effects are going to take much longer. And so that's why if you're a patient, you've been denied a preoperative exam because of your A1C being too high, there's a reason for that. And the reason is the healing effects are going to take much longer. The immune system might not react the same way it would if you had a normal blood sugar. And so you're more at risk, not only for prolonged healing, but potential negative health outcomes. So diabetics, they have an increased risk of negative outcomes like heart attack or stroke. And that's, like we mentioned before, secondary to pro-inflammatory response. And like we mentioned, diabetes can blunt the response of both immune systems. There's two aspects: the innate immune system, which is that first line of defense, and the acquired, which is our T and B cells, the ones that secrete antibodies and are responsible for memory of certain pathogens, and including viruses and bacteria. So they're more susceptible overall to illness and disease, or even repeat illness and disease. So what are our crucial take-home messages from today? Blood sugar control is crucial. It's crucial to maintaining a healthy immune system and a lot of other things. But in this case, just making sure our immune system is working properly to help you fend off disease and prevent you from getting disease as well. So you want to set a goal with your primary care practitioner or endocrinologist if you meet with them, if your hemoglobin A1C is elevated. Even if it's not elevated and you're showing pre-diabetic levels or levels that have high blood glucose over 100 fasting, you want to talk to your provider about different diet, exercise strategies, possibly medication management that we can do to help, okay? And you want to seek annual screenings for these fasting glucoses and hemoglobin A1Cs. And, we can also take something away as providers. We got to understand that our diabetic patients, are not only more susceptible to disease, but susceptible to severe disease given the inflammation and inadequate functioning of the immune system with hyperglycemia. And so it's important to help the patient reach those goals of below 7, below 6.5 for hemoglobin A1C. The last one, which is, one of the most important one, is eating healthy and exercise can help prevent diabetes and hyperglycemia. I say it all the time. Exercise is, the best form of medicine. It helps cure almost everything. And so these two things are crucial in preventing high blood sugar and thus maintaining a very healthy immune system overall. And those are my messages, and these are my references for today. I thank you all for your time. And if you have any questions, please reach out to me. With that, I'll be bridging the discussion over to Caroline here.
Awesome, thank you.
Before we start into Caroline's, I just wanted to kind of comment on a couple of the things that you said, Joe. I think one of the probably like easiest messages, right, for the patients is don't wait until you don't feel good, right? You need to be taking actions, right? Seeing you, their healthcare provider, getting your A1C done, testing your glucose at home, if you should be doing that. Because I think one of the things that's kind of a message throughout any provider, right, or any specialty that we've had on our webinar series talks about the fact that sometimes because your blood sugar doesn't just go up and stay up overnight, right? It's a gradual thing that your body gets used to that feeling. And I know Dr. Hundle has mentioned that a few times that, you get used to going from an A1C, right, of like 6 to then 7 and 8 and 9 and 10 and 11. So you may not feel bad, but it is affecting your body, right? That's really the message we're trying to say is the effects that that can have on your body without you really knowing about it. And you don't want to wait until you really know about it or you have one of those um, uh, severe medical conditions, right? That you had mentioned about the inflammation and the cardiac problem. So I just kind of wanted to stress that a little bit or see if you had anything else that you wanted to add around that message.
Most definitely. So not only is screening a big factor in this, but if you do have a high hemoglobin A1C, I want to reach out to you personally because what's happening is all of these things are kind of promoting an inadequate immune system and immune response. And so, maybe you don't consider it's important to get that A1C goal like your provider does, but it is important because it's not just high blood sugar. It's all the effects it has on the body, not only with the immune system, but promoting that plaque formation can lead to negative health outcomes later on in life. And so when your provider tells you, this is the goal I want to set for you, what can we do to help you better reach that goal? And what can you do to help you better reach that goal? Because it may not be a problem now. Like you said, Donna, you may be feeling fine and not have a problem because the body is great at adjusting. They're great at adjusting. So you may not feel anything now, but it's going to affect you possibly later on in life or your response to the everyday pathogens, bacteria, viruses. We see the uprising in COVID. We see the risk of developing severe COVID. Diabetes and uncontrolled glucose and sugar is part of that risk. And so it can make our patients more susceptible to having severe COVID or having severe infections that just take so much longer to heal. And even if you are healed, is your organ function, bodily function, 100% the same after that? And sometimes patients say no. And so it's just long-term health effects. It's imperative that we focus on trying to get below our A1C goal and trying to find ways to control our blood sugar overall.
Yeah, very good points. We talk a lot about risk prevention in counseling and in our diabetes education appointments because we can prevent things from happening, right? We can catch it early if we're in pre-diabetes. We can prevent blood sugar from being elevated for too long by food and exercise choices, just like Joseph was talking about. So there is a happy side to this where we can work on risk prevention and keeping our immune systems healthy, keeping healing healthy. I know wound healing, especially, which we've talked about before, can come into play. So it can all be prevented, which is good to talk about too. Anybody else have anything to add before we dive into the nutrition portion?
I don't. I think it was kind of a good segue into what you can do, how the dietitian can help you achieve those goals in addition to your provider.
Yeah, dietitians play an important role, and I recommend every diabetic patient or patient with high blood sugar in the past to talk to a dietitian, nutritionist to discuss better and healthier options. Sometimes patients don't realize what they're eating has a lot of sugar in it, okay? Or they may not be taking the right steps towards those changes. So, Caroline, I appreciate your work. It's very important. And also something that I encourage patients that are watching this with diabetes to reach out and try and get in contact with a dietitian or nutritionist.
Absolutely. Even if you think you know all the things, I've had quite a few people this week tell me, I know what I'm supposed to do, I just don't do it. We're talking about goal setting next month. So join us for that next month where we talk about ways to goal set and get you to that next step for all of those health and behavior changes that we talk through too. Okay, so we're going to dive into the do's and don'ts of food, safe shopping, storage, and meal prep, kind of going hand in hand with um, talking about immune function and sickness. We're knee deep in holiday season right now, so this topic's even more relevant with leftovers, food storage, food preparations, because we know diabetes puts us at risk for developing foodborne illness. Because of the slowed gastric emptying, it causes that bacteria a greater chance to multiply, which could make you pretty sick. So we do want to take precautions with our food, and that's one way to help keep you healthy through the holiday season, because no one wants to be stuck down with a stomach bug. But we know that those high glucose levels do suppress the function of those white blood cells of trying to fight off infection. So we want to reduce risk as much as possible. So we're going to kind of walk through preventative measures so we don't have to catch any nasty bugs if we can prevent it. So we're going to walk through shopping, storage, prep tips to keep ourselves healthy and keeping our food safe this season and every season. So we're going to start where we normally start, where we get our food at the grocery store or wherever, farmer's market, wherever you would shop normally. We're going to go through some do's and don'ts. So we're going to walk through the grocery store, we're going to walk through storage, and then we're going to walk through kind of preparation. So first things first, when we're in the grocery store, we want to focus on the do's. What do we want to make sure that we do? We want to keep our produce separate from meat, poultry, seafood, eggs in the shopping cart. This is due to cross-contamination. So a lot of the time, like we don't want our packaging to be ripped or anything, but sometimes there can be some leakage from the packages, which could get onto some ready-to-eat foods, which could potentially contaminate your food. And if you're already immunocompromised, right, we don't want to have any of that bacteria get into your body. Placing the meat, poultry, seafood, and eggs in a plastic bag at checkout or a separate bag at checkout is also a way to prevent that cross-contamination. So we don't want to kind of mix, you don't want to throw, I don't know, tomatoes in with your chicken because that could end up cross-contaminating and make you pretty sick. We also want to make sure we check the dates of the products while you're shopping. So when do you intend to make the meal, right? If you're looking at some chicken and it's going to expire in 2 days and you're planning on making it tonight, you're probably in the safe zones there. But if you're looking at a package and it's going to expire tomorrow and you plan on keeping it in the fridge for the next week, you do want to be mindful of those date ranges that you're having for your packaged foods especially. Now, if you're going to freeze it, that's entirely different. If you notice there's a sale like 50% off the meat, it's going to expire in 2 days and you're going to freeze it, that's an entirely different story. The freezing stops that bacteria growth. So usually you're in the safe and clear there. But we also want to focus on the don'ts, things you want to try to avoid. Some of these go hand in hand with our do's, but avoiding damaged packaging on those meat products. So looking for leakages, you can even look for like those meat products that in the freezer section that have ice crystals on it. Those tend to be signs of that they've been thawed and refrozen. So trying to avoid any of those packaged items that might have those icicle crystals on it, anything that looks of an odd color, that smells. If your fish smells a little fishy, it probably is a little fishy and you probably want to avoid it and choose something else. So just be really aware of the products you're choosing, looking for kind of damaged and leaking packages. Don't buy any eggs. I know most of us pick up the egg carton and check inside to make sure that nothing's broken, but we don't want any shells to be damaged because that could cause some contamination as well. And then another thing is it's not only about meat, products, right? We find it also in bulging canned foods, things like damaged and dented cans that might be leaking or look a little dirty. We do want to try to avoid buying those dented cans that could be contaminated with toxins, bacteria. We want to avoid that at all costs. So looking for pristine packaging, nothing's been opened, can help you prevent any kind of sickness as well. So our next is we have bought all of our groceries and now we are home and now it is time to store our food. So this can look different from home to home, but we want to make sure we do have some safe practices here and there. Especially keeping produce and other ready-to-eat food items still separate in the refrigerator. So they were separate in the grocery store. Keeping them separate in the refrigerator is going to be key as well. Because if you think any point that could leak, it could fall onto a ready-to-eat food, you could eat it, not know it, and then end up getting sick. We then want to make sure we refrigerate. So having that time between getting home and storing your food, you don't want it to sit out as often. You don't want to leave your groceries in the car without, a cooling source. So refrigerated food should be refrigerated within 2 hours of grocery shopping, or 1 hour if the temperature is above 90 degrees Fahrenheit. Because if we leave it at room temperature too long, that creates a breeding ground for bacteria, which we don't want. Especially if you're more susceptible to sickness. Making sure, double check your fridge is set to 40 degrees or below and your freezer is at 0 degrees or below. Double checking, like even doing a little survey every couple months on your refrigerator and your freezer to make sure they're reaching those temps. Because if they're any higher, that bacteria can start to grow and multiply. So we want to make sure that you maybe have a checklist every couple of months to check in to make sure that your appliances are working properly. And then we want to make sure that this is a big one. I know people do this different everywhere. I know I grew up with chicken being defrosted on the counter. I'm still alive, but we want to try to avoid that if we can, especially if you have diabetes. We want to defrost the food in the refrigerator, right? It's going to keep it at a food safe temperature. It's not going to cause a breeding ground for bacteria. You could thaw it in cold water or in the microwave if you're intending to use it immediately. We want to avoid any chance that it rises to a certain temperature that's unsafe for too long, which then causes you to have an increased bacterial growth. So while some people are still alive after having it fall on the counter, highly recommend that you refrigerate it and let it thaw overnight or under cold running water to keep it. I think it's about 70 degrees. Don't let it get above 70 degrees in that cold running water. So going to the don'ts, making sure that we place it in the correct, those raw poultry, meat, seafood things, place it in the correct place in the fridge. We want to put them on upper shelves, right? We don't want to put them on upper shelves because of the chance of leakage. Putting them at the lowest point in the refrigerator, usually in the center of the refrigerator, because that's the coldest portion of the fridge usually. So we want to try to avoid keeping them at the highest point because it has more chance to kind of, if your package dripped or something like that, trickle down into those ready-to-eat foods. We want to make sure we don't remove the eggs from their carton or keep them in the refrigerator door for a couple of reasons. When you remove the eggs from the carton, you're missing out on the expiration date. I know sometimes it's a best by date usually, so the eggs can last a little bit longer than most other things past their best by date. So as long as they're kept at a food safe temperature, but there is more potential that they'll get cracked out of the container that they're originally purposed to be in. So we usually advise keeping your eggs in the container that they come in. And not keeping them in the refrigerator door. You'll notice we say keeping dairy out of the side of the door, which we'll talk about in a minute, because it's the warmest part of the fridge, right? We want to keep everything below 40 if we can, but that fridge door keeps opening and opening and opening, and it's exposed to the most circulation of warmer air. So we want to make sure that we keep all of those spoiling items off the side of the fridge if we can. This one can be a big one for the holiday season. Try not to overfill your refrigerator or your freezer. It creates more warmth, right? So the more things you pack in there, the less that cold air can circulate. So not overfilling it. If you have a second fridge, spread them out. If you have a cooler and you just need it to stay cool for 2 hours, put some other things in the cooler that might, like some juices and things that might not spoil as quickly. Put them in and leave some room for those foods we want to keep safe for eating. And then I already covered, don't put your meat on the counter. We don't want anybody getting sick from that. So this is just a quick look at how to store food items safely in the refrigerator. So we've got kind of an order, and a similar order is used. So if you were to go to any kind of restaurant, right, or any kind of food facility, right, they would have a similar guide on how to store your food in the refrigerator to prevent foodborne illness. So up on the top, we can see there's processed meats, smoked meats, sausages, dairy products, and cheese, right? Those are all ready to eat foods, right? They're not going to cause much contamination. Keeping them at the highest point in the fridge is going to be perfectly safe. Next, we have our top shelf, which is our ready to eat items, yogurt, sauces, drinks, jams. You can eat them anytime. But then below, you've got your meat, fish, and poultry, the coldest part of the fridge. We want to keep that separate from everything else, prevent any kind of drip down from damaged packaging or anything. But as you can see, the fruit is actually below, right? So that might be confusing because the fruit is below that meat area. And this is because this is in a separate place in the fridge. So there's actually that pull-out drawer that has a separate compartment. So there's an extra form of protection there where it won't kind of drip right down. So setting low humidity for storing that produce will help it spoil a little less quickly. So keeping vegetables and fruit separate from that meat product, but that's usually why you see that bottom shelf items above the fruit and vegetables. And then we've got freezer items. Keeping ice cream, higher fat foods, foods quickly to spoil, meat's about to expire. You can even do it with vegetables about to expire. Throw them in the freezer. You don't have to have any food waste there. But avoiding keeping any of those quick spoiling items in the refrigerator doors and leaving that for those bottled drinks, juices, butters, herbs, sodas, oils, things that don't spoil as quickly as like a meat product would that aren't a breeding ground for bacteria. And as always, I always point out to patients, check your dates and your labels. Have a quick reference guide of when you bought something, because sometimes you might find a salad dressing from 3 years ago. So you just want to be aware of things that are in your fridge. Have a rotating schedule, and there are some food establishments, they do an actual checklist, right? First in, first out. That's what they call it, right? So the oldest thing gets pushed to the front, and then we use that first, and then we go on to use the new thing next. So that kind of helps prevent eating something past the expiration date, which is also a way to prevent foodborne illness as well. So now that we've stored our food, we've done all we need to do, we're going to dive into kind of food preparation. So how do we prepare food safely without contaminating or getting sick through that food preparation? So the do's that we want to focus on, we do want to wash our hands for 20 seconds before preparing food. There's a lot of bacteria, even like touching things in our house. It might not be, it might not be sick for us, right? It's our germs. Our germs are all over our house. But especially if you're preparing for other people, your germs are different from their germs, which could make them very sick. So washing your hands is a great way to prevent any kind of sickness from spreading. We want to make sure that we rinse our whole fruits and vegetables under running water and dry them with a clean cloth, let them air dry, salad spinner. Rinsing, you don't know where that produce has been. I always have the visual of, especially like apples and things that you would readily eat the skin of like the grocery store where people like pick up an apple and put it down, right? And then if you were just to take that apple and eat it, you don't know how many people touched the apple. So allowing your fruit and vegetables to be washed, especially if they're ready to eat, that fruits and vegetables and you're eating them raw, we want to definitely make sure that you rinse them off really well. Keep on washing your utensils that you've touched with uncooked meat, poultry, seafood, eggs, flour before using them with any other food, especially if that food's going to be eaten raw. So we don't want, like, have a separate spoon for your cooking your chicken and have a separate spoon for cooking your vegetables. That way you don't cross the two and end up contaminating with, a bacteria that was on one or the other. Especially with clean cooking surfaces, use that hot soapy water after every use. There are designated cooking cutting boards in restaurants, right? And sometimes I like to have my cutting boards color coded so I know which one goes with raw meat or vegetables. That can help prevent cross-contamination. If you're using 2 separate utensils in total, you have less likely of a chance to cross-contaminate. Keeping meat, poultry, and seafood warm, 140 degrees or above between cooking and serving. So in a little bit, we'll talk about, how to temp our meat, but leaving food sitting out, right? We want to make sure it's heated. So, right, if you have a crock pot heater or anything like that at the holidays, making sure that it stays at that 140 degrees. And usually after 2 hours, we would throw it out because we don't want any that after 2 hours, it kind of has that breeding ground for bacteria to kind of increase. And then cooking your meat and poultry, which we'll get into in a minute, but we want to make sure we have a safe internal temperature. We hope that everyone should have some kind of meat thermometer available so that you can check it. If I haven't reached the point of my chef career where I can look at something until it's done, I temp everything. But we do suggest having an internal temperature, which we'll go over the specifics for each meat product, seafood product, anything that's going to be cooked from raw. Discard food that's been sitting out for over 4 hours, right? So food for 4 hours, 2 to 4 hours is the key point. Cold food, especially, dispose of after 2 hours. 4 hours for that hot food. We don't want it sitting out any longer. So they do at food safe restaurants, right? After 4 hours at the buffet, they should be throwing it out and not reserving it. So that should be the same in our homes as well. So then going into our don'ts, which kind of correlate with our do's again. Don't wash your meat, poultry, seafood, or eggs. Don't throw your chicken in the sink and rinse it off because that's just going to throw all of the bacteria all over the place. So the bacteria is killed when you cook the meat, right? So there's no need to wash it. If you want to pat it with a little bit of a paper towel to kind of get sometimes it can be slimy, you can pat it a little bit, but there's no need to actually rinse those items off. Don't use soap or detergent on your foods, especially if they're ready to eat foods. Those things aren't meant to be they're not food safe things to be put into our bodies, right? A fruit and vegetable washer is perfectly fine if you have like a fruit vegetable spray that's been designated food safe, perfectly fine. But we don't want to be using outside soap or detergent on those foods to try to remove extra dirt. We don't want the raw poultry, seafood, eggs, and flour to touch anything that will be eaten raw. I think it's important to note flour. I had this conversation when we were baking cookies recently of why we don't eat, raw cookie dough. Flour is actually one of the main contaminants, like with the salmonella, that causes foodborne illness. So sometimes it's the eggs, but most of the times it's the flour. So flour would be in that category of try not to eat it raw. Usually we want it cooked. Next, we don't want to reuse plates, cutting boards that have touched that uncooked meat or flour or eggs unless you wash them first with hot soapy water. So if you wash them, perfectly fine, but we don't want to cut our chicken and then go to the vegetables. However, if you're cutting the vegetables and then you go to the chicken, that would be okay because you're going to end up cooking the chicken, right? You have less chance of getting that foodborne illness from that vegetable into the chicken. So we don't want to cross-contaminate, but the order that you do things in could be important in that process of preparation. We don't want to serve undercooked meat. We want to temp everything, which we'll get into in a second. And don't allow foods to cool before refrigerating. So I know sometimes after dinner, you could let something sit on the counter for a little bit. It's too hot to put in the fridge. I don't want to do that yet. But the longer you leave that item out, the greater the risk of that bacteria multiplying. So we don't want to have that happen. So put it right into the fridge. If it's too hot to put in the fridge, maybe put like pot holders underneath of it. I've actually put it on top of an ice pack in a fridge before to kind of help cool it faster. The goal is to bring the temperature down as quick as possible so that we don't have a bacteria growth. And then again, don't let food sit out for more than 2 hours, especially if it's cold. 1 hour if the food is above 90 degrees Fahrenheit. That's more of an issue as well in the summertime if you're having cookouts. We don't want you to leave any cold items out without refrigeration or any kind of cooling mechanism. So I mentioned that we would be going kind of through the cooking meat to the proper temperature, which can sometimes be confusing of where do I put the thermometer? What kind of thermometer do I use? And what specific temperature goes with some specific meat item. So we've got a couple different options here. We've got beef, pork, veal, lamb, steak, chops, roast. Anything in that steak category is going to be about 145 degrees Fahrenheit with a 3-minute rest time. So as you can see in our steps, right, allowing the meat to rest can still continue the cooking process. So you don't have to cook it until it's, dead again. You can keep it sitting and it can come to that internal temperature, but you still would want to check it after that 3 minutes to make sure it actually reached the 145, which can guarantee that most, or if not all, the bacteria has been killed off. Poultry is 165. So you're heating up your poultry to 165 to make sure that you have killed all the bacteria. Ground meats are 160. So even if it's ground beef, right? We see a 145 for beef. Oh, so maybe 145 for ground beef. It's different because there's been more processing with the ground beef. It has gone through a machine to ground it up. So there's an increased risk for higher bacteria growth. So we want to make sure you cook that to 160. Fish and seafood is a little bit lower. It's at that 145 range as well. Fish and seafood and some of the other items are you can tell when they're done, right? Because the consistency and color changes, but sometimes that temperature didn't reach the exact amount. So I'd always encourage, when you're using a meat thermometer, insert the food grade thermometer into the right spot. For white meat, it's inserted into the thickest part of the breast. For red meat, it's that center portion away from the bone. The bone is going to carry a lot of heat, so you don't want to put it next to the bone because it could give you an inaccurate reading of what your meat temp actually is. Get it to the right depth. I know a lot of, especially the ones that have like the long little steel stick, have like a little groove, like a 1/4 to a 1/2 an inch. You'll insert it past that groove. So a 1/4 to a 1/2 inch, depending on the type of thermometer. There are tons of thermometers out there that you could use. I'm just referencing the one that has like your average food thermometer with the little display screen and the little stick attached. And then we already said, don't wait until the food hits temperature. Carryover heat is a way to allow it to continue cooking, especially with those steak items or those full cuts of meat. And it can prevent the drying out. So you still kind of keep those juices in the meat to not compromise on taste. So just some food safety reminders. Clean. We want to clean and wash utensils, surfaces often. Germs can spread and survive in many places. So especially if we're immunocompromised or we have diabetes and our blood sugar is high and we're more susceptible to foodborne illness, we want to make sure that we clean as much as we can, keep things soapy, hot water, sanitizer if you need to, but usually hot soapy water is enough. Wash your hands regularly. Separate. So in all instances, we saw, from the grocery store to the fridge to the preparation, there was separation between the raw meat and the ready to cooked food. This prevents any germ cross-contamination of spreading. So keeping them as separate as possible. And then cooking. Food is safely cooked only when that internal temperature is high enough to kill the germs that can make you sick. So as often as you can, check that temperature. Even if it looks done, it takes maybe a minute or two to hold it in there. Check to make sure you've reached that internal temperature just to limit your risk. And chill. So refrigerate perishable foods within 2 hours if the food is exposed to temperatures over 90 degrees, like at a hot car, in a picnic, or something like that. Refrigerate within 1 hour to prevent the spread of bacteria. And that is just our overview of kind of food safety. Kind of circling back, we want to make sure we can prevent as much illness as we possibly can since we know we're at risk with diabetes. But this goes for everybody. Someone with an older age is more susceptible to foodborne illness, or of a younger age. So it applies to everyone, but we just want to make sure, especially through the holiday season, that we cover all our bases in safe food prep, storage, and shopping. Any questions?
Thank you, Caroline. So one thing I did just want to kind of mention, I know you talked about, keeping it warm or keeping it cool. So I know there are things that you can do out there, right? If you're having something, whether it's in the house in the winter months, like the holidays, or outside, is, putting food that should be kept cold in a bowl, sitting inside another bowl that maybe has ice in it. Or, some places sell, different types of cookware or storageware that has built-in things that you can put in the freezer, and it remains it's iced, and so therefore you just sit the food on top. Or putting it in the chafing dishes where it stays warm, so that you can keep foods as healthy as possible. So I just wanted to kind of mention that as well. You don't have to have something fancy. You can just put one bowl inside of a bigger bowl with, ice in there or something of that nature, especially if you're serving things that might have, mayonnaise or,
Yeah.
anything that, like you said, does need to stay, cool. And, if you're hosting something, you kind of lose track of time, right? As you're trying to, talk to your guest or be a good hostess or a host. So having those things set up ahead of time can also be helpful and keep everyone safe. So I don't have anything else. Do either of you have any closing comments for today?
I just thought it was interesting how simple it is for contamination to spread and happen.
Well, so easy.
So easy. And I mean, I don't know why, but I always washed my poultry before. And I think it was because you mentioned the slimy feel
Yeah.
just didn't sit right with me. But I mean, there's so many things you can do to mitigate that risk. And it was interesting for sure. Thank you.
Yeah, and everybody like don't fear going to restaurants. Everyone has to be serve safe certified in a restaurant, right? I've gone through that training myself when it makes you think about a lot of things. So you're much more aware of your surroundings. So our job is to, share that information to make sure you are aware of your surroundings, and some of the old practices that we maybe did before probably aren't the best to continue.
Right. Well, thank you both again for joining us right before the holidays. And so, as Caroline said, we plan our January wellness webinar. We plan to have Dr. Hundle, our endocrinologist, joining us to talk about New Year's goal setting. So look forward to that topic. And again, we want to wish everyone a safe and happy holiday. And thank you again for joining us today.